Ladies and gentlemen, good afternoon, and welcome to the February 8th, it is February 8th, isn't it? February 8th edition of the Washington County Public Affairs Forum. Thank you. Today we have an absolutely fantastic program. I mean, I haven't heard it yet, but I'm very, very interested, and I'm sure we all are. We have Joanne Krumberger, from the Portland VA, and she has about a 20-minute presentation, and then those of you that are paid up forum members, if you'd like to ask questions, you can line up over there, but we'll talk again. Ladies and gentlemen, Joanne Krumberger from the Portland VA. Thank you.
Thanks very much, Rob, and thanks to both Rob Solomon and Spencer Ehrman for your kind introduction here this afternoon. It is my pleasure, and I see some familiar faces in the audience. Bill, who's a member of our Portland Veteran Family Advisory Board, we really appreciate you being here. I'll talk a little bit about that advisory board when I get started here. And I also would like to introduce Ms. Kelly Roche, who is our Public Affairs Officer. She's going to help me with slides. I do have about a 15-minute or so presentation, and then we can open it up to questions. It is my proud distinction to be the director of the VA Portland Healthcare System and to be here on behalf of our over 4,000 employees, 800 plus volunteers, and on any given day, 1,000 plus students, who are all here to fulfill Abraham Lincoln's promise to care for him who have borne the battle for his widow and his orphan, a mission that we take very, very seriously in the Department of Veterans Affairs. The next slide talks just a little bit about our mission, our vision, and our values. This is the core of what we do. We're here to honor Americans' veterans by providing exceptional health care. As you know, the Portland VA is part of the healthcare arm of the Department of Veterans Affairs. And I'll talk a little bit about our healthcare system for those of you who may not be familiar with all the areas that we cover. And of course, our vision for caring for all of our veterans is to be known for excellent health care. We also have a robust research program, 12th largest in the nation for VA research. We have many, many students. I'll talk a little bit about our teaching mission. And then also we provide backup to the Department of Defense in the case of a national emergency. And we hold very dear and walk every day our values of integrity, commitment, advocacy, respect, and excellence for everything that we do. For those of you who are not familiar with how the VA is organized, the next couple of slides just talk a little bit about that organization. As you know, across the country, we have over 157 medical centers now. And they're organized into networks. And what that means is that you provide care for a population of veterans in a geography. And here you can see that VA Portland Healthcare System is part of what we call Network 20. So we do have sister facilities in our network, and we often have patients who go back and forth between different medical centers within our network, and particularly coming to Portland, because we are amongst the most complex VAs in the country. So we provide the full range of healthcare services. And there you can see our visit in the corner. And here you can see that Secretary McDonald in the next slide. He did do some reorganization of the Veterans Health Administration in terms of medical centers to make sure that they were geographically dispersed along state lines. The take-home message for you is that VA Portland didn't change at all with Secretary McDonald's realignment, as our catchment area included most of the state of Oregon and a portion of Southwest Washington, and so those geographic boundaries did not change. The next slide shows you VA Portland Healthcare System and the location of all of our sites of care. Our Portland division, our main hospital, is here in Portland. And we also have a second division, our Vancouver division, which is over in Southwest Washington. So here on the hill, we have our medical center with our hospital. And I think future slides talk a little bit about this, but our main hospital, we are licensed for inpatient care. We have all specialty care is at the main hospital. We also have our research program, we have primary care, we have mental health, and so the full range of services for VA Portland is really located at the Portland Division site. Then in our Vancouver Division, we have our nursing home care unit, which is our community living center. And we have 72 licensed beds there. We have rehabilitation beds in Vancouver, as well as primary care, mental health, and many specialties. In a future slide, I'll talk about some of the construction we have going on, particularly in our Vancouver campus and the growth there. And then, as you can see on this slide, we have 9 other sites of care, which are primary care clinics, which also have mental health embedded in them. And as you can see, we have them at Newport, Lincoln City, Warrenton, Bend, Salem, East downtown Portland, Westland, Hillsborough, and the Dalles. And unique to us downtown is our PRRC, which is our homeless outreach center in downtown Portland. So here you can see that we are very large. We span 26 counties and over 30,000 square miles to provide veteran care. When you take a look at VA medical centers across the country, they're either level 1 complexity, which is the most complex, level 2, which is medium complexity, and level 3, which is outpatient only. And Portland is not only a level 1 facility, which is complex, but a 1A complexity, which is the most complex among VAs in the nation. The next slide just shows you what I summarized. We do have 167 medical surgical beds, which includes a mental health unit and also intensive care unit beds. And I mentioned our Vancouver division that has a 72-bed nursing home and 35 residential treatment program beds, which are dedicated to our mental health population and provide some longer-term mental health care for patients in an inpatient setting. Here you can see we have about a $716 million budget on terms of on board, which is head count of employees. We have about 4,200, but we also have a lot of staff who come to us without compensation, providers, for example, and so those numbers cap over 5,000 total. And then, as I mentioned, we have 800 plus volunteers who are part of our staff, as well as over 1,400 residents and students that not only are clinical physicians, mental health providers, psychologists, nurses, pharmacists, but also a full array of administrative students in fiscal and in HR. So over 200 different specialties of students who come to train. And we also have a very, very robust research program on the next slide. We have almost 33 million active research dollars of state-of-the-art scientists who are studying the newest therapies for veterans. This could be pharmacological types of interventions, treatment types of interventions. We have almost 500 plus active research protocols currently, and we are known for many centers of excellence, research centers of excellence. So we are the 12th largest VA research program. And the meaning of this is that we have the state-of-the-art researchers who are researching newer therapies that have yet to be developed, again, to continuously improve the care and service that we provide to veterans. And on this slide, you can see the many centers of excellence and the types of areas that some of our researchers are researching. I could spend 2 hours just talking about all of the research protocols, but just wanted to give you an overview. And please know that we've left the slide set with your leadership, so if any of you are interested in getting a copy of these, those can be provided to you. As we look to the VA system, and particularly VA Portland healthcare system, we have always had what we call a robust strategic plan. You know, what are the things that VA Portland healthcare system has always been known for? And as we move into the future, what we will continue to be known for in terms of providing top-notch, world-class healthcare to our veterans. And we call this our Journey of Excellence, our strategic plan. And it's aligned around 6 core pillars. And each one of these we talk about regularly to take a look at how can we continuously improve, how can we look forward and make sure that we continue to provide the highest quality of care and service. And those pillars or things that we focus on and will continue to focus on will be our people. This is our staff. We know that we have many staff who come to us who are very talented, and we are committed to making sure that they have the right education, the right tools, and the right support so that they can continue to provide frontline health care as well as help support that health care with administrative services. So a strong focus on our people. The second pillar is related to safety. We always want to be focused on providing safe patient care, as well as to make sure that the environment that our staff work in is safe. So our safety is both dedicated, to patient safety as well as staff safety. The third pillar is always our dedication to providing the highest quality of care, health care, to our veterans. And we have many ways that we monitor to make sure that this care is of the highest quality. The next pillar is service. And this is customer service to our veterans, their families, their loved ones, so that everyone who comes to us, we are always providing that highest quality of service, customer service to our veterans. The next area that we focus on is stewardship. And that is, we are entrusted, as you saw our budget, with resources. And we want to make sure that we're using those for the right things and that we are always efficient in what we're doing. And that everything that we get better at and we become more efficient in, we take those dollars and put them right back in to the care and quality of service that we're providing to our veterans. And the last pillar has to do with innovation. Our best ideas come from our frontline staff. And so we have developed a program to capture those ideas of staff so that we can listen to them, always looking to how we can improve the care and service that we provide to our veterans. The next slide just shows you a few of the distinctive awards and recognitions that VA Portland Healthcare System has received over the years. Most recently this summer, we were redesignated for Magnet Distinction, which is the highest honor any facility in the country can get for nursing care. Third time VA Portland Healthcare System has been recognized for the excellence in nursing care. And I could go through these many different awards, way too many awards to even fit on one slide. But we're very proud of our staff and their enormous contributions to the care of our veterans. I'd like just to end a little bit on a national perspective, and I would anticipate there might be some questions about Secretary McDonald's My VA. Many of you may have heard of his strategic plan moving forward. And here you can see that he has defined 5 major areas and objectives for the entire VA system. And here you can see that if you read this slide, they align exactly with the journey of excellence that I just described to you. That he wants us to be about improving that veteran experience, always providing the best customer service, improving the employee experience, again our focus on our staff, improving our internal support services, which are all of our administrative support services, always continuously improving, which is part of our quality initiatives, and lastly, to assure that we develop strategic partnerships. We have partnerships with so many other agencies, whether they're the other healthcare systems where we have patients going for care. It might be with the community, for example, with our homeless population. We have initiatives ongoing with the mayor's office, the commissioner's office, other agencies. I could go on and on about the many partnerships that we have where we all come together and talk about how we can provide better care and service to our veterans. The next slide just acknowledges that probably one of the most important legislative changes in VA's entire history was the passing of the Veterans Access, Choice, and Accountability Act in 2014. That was in August 7th, 2015, and this legislation was updated in August of 2015. And this provides veterans with the choice to get care in the community if, one, they're not able to get that service within the VA within 30 days, or they live greater than 40 miles from one of our VAs. And so both of these expanded access, these 2 laws for veterans. And since November of 2014, we have been deploying what's been called the Veterans Choice Act. Many questions have come from VA stakeholders and as well as veterans themselves about the choice program. And I can tell you that the next slide tells you about the 5 provisions that improved the act in August of 2015 from the original legislation that was signed in July of 2014. What this did was helped us to better take care of veterans and their health needs. Originally, there was a 60-day limit on an episode of care. So for example, if you could not get in for an elective knee replacement at Portland within 30 days, you would have the choice to go into the community and you would be approved to get that care in the community for 60 days. That's what the original legislation said. This update to the legislation removed that 60-day limit. Because some things, when you take care of patients in the healthcare system and setting, it takes longer than 60 days to take care of that. Does that make sense? That maybe you have to treat someone longer than 60 days, but the law only let us get that care for 60 days. This allows us now to go up to 1 year for an episode of care, and that's based on the individual needs of the veteran. The second change was to remove the requirement for enrollment prior to August 1st, 2014. In the original Choice Act legislation, if you had not enrolled in the VA prior to August 1st, 2014, you were not eligible for choice. That changed this past summer, and now there is no date on enrollment eligibility. All veterans are potentially eligible if they meet the requirements for eligibility. It also expanded the secretary to be able to expand some criteria where it makes sense clinically. And then it adds provisions when care cannot be provided by VA by clinically indicated data. What that means is that in any veteran, when they come to us for care, the provider takes a look at that veteran's individual needs and determines when clinically they should come back for care. And that's based on the individual veteran's needs, and that changed, and that was a very good change. And then it changed the requirements for distance from an outpatient clinic related to full-time physician availability. And what this means, and this is not actually applicable to VA Portland, we do have a full-time provider in each of our clinics. And so all of our clinics are able to provide care with a full-time physician. The next slide just shows you that as of January 19th, to end fiscal year 15, which ended on September 30th, 2014, we cared for over 96,000 unique veterans. A total of 46,000 veterans were notified that at least one thing that they were looking to get care for, we couldn't get them in within 30 days. Out of these 46,000, 21,000 chose to get care in the community. And that's not the total number of unique authorizations. That was the total number of unique either procedures or treatments that were authorized. And so 12,409 veterans, unique veterans, got care in the community in the last fiscal year. And so as you can see, we called over 13,500 veterans who decided that they did not want to elect to get care in the community. They chose to wait for Portland, and we called them again to make sure that they were well enough to be able to wait and to make sure that they still wanted to wait for care in the VA Portland healthcare system. Before I end and open it up for questions, I want to just talk about a few new things that are coming. On our Vancouver campus, we'll be opening our very first Fisher House. This is a gift from the Fisher Foundation family. And it is a home that will be free of charge to loved ones who've come to be with their veteran. When a veteran is coming to us for care that takes some time and they don't have the resources to be able to pay for an apartment or to pay for a hotel room. It could be someone who's coming to us for open heart surgery, a liver transplant, someone coming for chemotherapy because they have cancer. So we're very pleased that on March 23rd, we'll be dedicating our brand new Fisher House. We just broke ground on our new Vancouver Primary Care Clinic, or will be very soon. We've got the notice to proceed. This will expand space for primary care in Vancouver. And we also broke ground, and it's made a lot of progress, a new Freedom's Path. And it's an apartment building for homeless veterans. And we will see that opening in this calendar year. We also have a lease that we're waiting to hear to expand our space in Vancouver. It's one of our most rapidly growing areas. And we expect to hear that very soon. And so until the new clinic is built, we're going to be able to lease space to provide clinical care. And then just in a few weeks, we'll have our ribbon cutting for our brand new Fairview Clinic. How many of you have been to the East Portland Clinic, which is very, very small? We will be tripling the square feet of that clinic, and that ribbon cutting is on March 3rd, 2016, just a few weeks away. So this was a very quick overview of our healthcare system, and with that, I'd like to open it up to any questions that anyone might have. Thank you, Rob.
Glenn, thank you very much. We appreciate it. You've given us a marvelous background, and I should tell you that Bill, who you know, is about to be your first questioner, and he was kind enough to suggest to us that we invite you.
Thank you.
Which is kind of my quick lead in. We have an absolutely fantastic board member doing our speaking, and I'm going to doing our speaking, getting us speakers. I'm going to embarrass him, but he was thanked earlier before. And I want a round of applause for a gentleman who's been doing a very good job for us. Spencer Ehrman is doing a great job. Thank you so very much. And we'll tell you who's coming up in the next couple of weeks, but we'll do that later. Right now, Bill, please go right ahead.
I'm Bill Kroger, a forum member, and Joanne, thanks for coming in today. It was a good speech, and you always speak well anyway. I know that the Portland VA, a couple years ago, when the VA centers in certain parts of the country were getting hammered because of appointments and screwing around with that the Portland VA wasn't any part of that. But I've read recently that there's been a resurgence of veterans trying to get care in the community. I mean, it's really going up quite a bit. And yet Congress has not authorized any additional funds to try to deal with these veterans and things. And you would think that if this is happening, it's got to put a lot of pressure on you and the staff and everything. I was wondering if you could talk about how you're addressing that.
Thanks very much, Bill. And again, thanks to Bill. One of the things that we did last year is we stood up a Veteran Family Advisory Board. And it is a board representative of veterans, family members representing every era of service. And they're our true advisors. We use them to get input and feedback on our most important decisions in the healthcare system, and Bill Kroger is one of our board members. How fortunate we are that we're able to have some great dialogue on all of the issues that are affecting VA Portland, and to get the expertise and hear from veterans themselves and their caregivers give us advice as we move forward. So as Bill asked, it was really about do we have enough resources in terms of the choice program. And I will tell you that looking at this fiscal year, Congress did appropriate significant funding with the Choice Act legislation to provide care in the community. And I look at the report, I could look at it every day and every hour because it changes. I get a formal briefing every single week. We have nothing that tells us that we will not have enough, so we will have enough resources to be able to provide that care in the community with the Choice Act legislation. And we monitor that continuously. But they did provide us resources to be able to, for veterans who did choose to get that care, there's no issue with us having enough resources to be able to get that care in the community. The other thing that the Choice Act legislation provided for is that it gave us additional resources to hire new staff. We do have what we call a supply-demand mismatch. We have more veterans coming to us for care than we can provide the services for, which is why the Choice Act was very important to us, that veterans can then now choose to get that care in the community if the waits exceeded 30 days. We were, in this last year, able to hire almost 150 plus or so new staff with the Choice Act dollars. And this was helping us increase our internal capacity to be able to improve access for veterans. So Bill, thank you for your question. We have enough money this year to provide for patients who choose to get care in the community with the Choice Act dollars. Thank you.
Hi, I'm Rob Solomon, forum member. Thanks, Joanne, for being here. I have two questions. I hope they're both quick. First, about going out to the community. I'm wondering, are the costs exactly the same? My understanding is that veterans' costs of care at the VA are completely covered. If they go in the community, there might be a copay, and I'm just wondering how that copay is handled.
Okay. So the first question has to do with copays. VA, for many years now, has had copays for some things. And it depends on the veteran's eligibility and service connection. It's different. If it's something for a service connection, that there's a different copay. So there's very strict regulations on what copays are. So when veterans come in to the VA system, not care in the community, they could be required to pay a copay. And that's been in existence for many years. With the Choice Act legislation, of course, this was very different. Now we're sending veterans out into the community, and there's a whole different set of rules, right? The community has its own set of rules in terms of copays. And one of the things that the VA looked at very early on was that there was a recognition that some of these copays would be above what the veteran was used to paying if they came into a VA. And our business office and the VA's policy has been, to every extent of the law, the VA would cover that difference. Now, there are specific circumstances where it gets very complicated, and we have a whole team of staff who are available to help individual veterans if they have questions about a copay that they receive, particularly if it was above what they paid or were used to paying coming to the VA, and that copay is very different when you get into either a community hospital or a community practice.
Certainly, and the reason I brought it up is you have 46,000 folks on a waiting list and only 21,000 went into the community. I would think I might be content to wait if the service cost was going to be much cheaper.
And that's why, that's a very good point, and that's why we didn't want that to be a barrier. And so that's why philosophically the VA looked at, we would cover that difference so that if the veteran chose to get the care in the community, it wasn't the cost factor that impacted on their decision.
That's cool, thank you.
So it is very, very complicated, and with any complicated process, we have some veterans who reported that it didn't work that way for them. And that's why we have our veteran experience officers or our patient advocates, a whole team of people who spend their whole day working veteran by veteran, because it really gets into the details of that individual veteran's care, their eligibility, their decisions around choice, and they help resolve any questions that the veterans might have with respect to their copays. Sir.
Thank you for coming.
Thank you.
A pleasure to have you here, Ms. Kronberger.
Thank you.
The idea of taking homeless vets up to the hospital and giving them service, this was told to me by a few veterans this morning, makes them a little angry that you're taking homeless vets and giving them service and you still have waiting lists for these other vets. I can't name specifics, and they're biker type guys, so, and killers on the other side, but it's the idea that you're not servicing people as fast as you could by going out and causing more. I know it's humane, but it's still the idea that you're not doing first things first.
Well, thank you for the question. And as we know, it was actually Secretary Shinseki, along with President Obama, that wrote the directive that we would end homelessness amongst veterans by the end of calendar year 2015. And you know, that's really functional because on any given day, there are more people who weren't homeless that become homeless. Again, what we always make sure of when we're taking a look at who gets care is always anything that is an emergency comes first. Anything that requires urgent care comes first. And what that means is that for any veteran, if it is elective, obviously, and I always, usually in these forums, use something like an example of you need a dermatology appointment. There's a difference between a rash that itches and it's annoying and a mole that we think is cancer, right? Which patient is always going to get in first? Always, no matter what, will get in, no matter what. And a lot of coordination to make sure that The sickest patients get care first. So in terms of the homeless population, most of those services are actually performed in the outpatient setting in our PRRC. That whole program is about getting them housed. If they have healthcare needs, they are not prioritized ahead of anyone else. It's based on who is the sickest and who needs to get that care first. The same criteria apply, that if you have something emergent, or it's an emergency, we make sure you get care right away. And if we can't do it at our main hospital, we make sure that that patient's taken care of that day. We have whole teams of staff to assure that that's a patient safety, right? Now, for elective care, there are still wait lists for VA Portland healthcare system. We've had the same clinics with lots of patients who have needs, and we can't get them in within 30 days. And so those are the patients that would be offered choice. All patients would be offered a choice, regardless of whether they were homeless or not. And they would have an opportunity to say, yes, I'll take that care in the community, or no, I would prefer to wait for VA Portland Healthcare's services. So we are very transparent, and we do many follow-up phone calls to make sure that this is absolutely clear to our veterans and they're making an informed choice. Right now, the majority of veterans are choosing to wait for VA Portland's care. But over time, as we've explained more and educated more about this program, it is the individual veteran's choice. We can't force them unless it's urgent, right? If it's an emergency, then we make sure that they're taken care of that day. So I'm not sure without the specifics and knowing the details of someone who perceived that homeless were getting in ahead. But if you have details and facts, we never share personal protected information in a public forum. But I'd be happy to have one of our staff look into the details of the cases and make sure that we can provide a good response. Thank you for the question.
Eric Squires, Forum staff. Thank you. Director Kronberger, thank you for your excellent presentation, well articulated, and I'm grateful for that. On one side of your presentation, I saw that you explained a system that was steeped in policy and procedure and locked up by law. The other side of your presentation, I saw that the institution was dynamic and evolving and changing. Leaning towards the second part of that statement, could you focus in on maybe 1, 2, or a maximum of 3 areas and tell me what changes you foresee in the VA, either nationally, systemically, or at the Portland VA? What I'm really asking for is just a quick little 30-second snippet of what's to come.
Well, first I just want to talk a little bit about community partnerships. One of the things that I neglected to talk a little bit about is the formation of the My VA Cascadia Board, which is not a VA board, but it is co-chaired by 2 community leaders, Mr. Tom Mann and Ms. Kimberly Dowded. And it is a board that's taking a look at how we can meet the unique needs of veterans. We know the Veteran Administration can't do everything. We know that. We have laws that preclude us from taking care of some things. And so what this board is coming together to do is to discuss those issues, and they're very community-based, and come together with external partnerships to see that what we can do that's new and innovative to meet the needs of veterans. That first veteran town hall is later this month on February 26th at 6 p.m. And we will make sure that you get information about that public town hall, where for the first time the board will be presenting about My VA Cascadia and talking about how we're bringing partners together to resolve unique needs of veterans. The second major area that we are focusing on is really taking a look at feedback from our staff. We want to continue to be the employer of choice so that we can continue to recruit the brightest talent of employees, whether they be healthcare providers or support staff. And so we want to be that place that anyone who's looking for a job sees that VA Portland is the place to apply because of the support and the resources and everything that we do to support our staff, who are our most precious resource. So that is a second area. The third has to do with innovation, that we need to continue to take a look at the best ideas of all of our staff on a daily basis. And we've started our journey of excellence, really meeting with staff where they work on a daily basis to hear the best ideas on how to improve the quality, the safety, the effectiveness of the care that we provide, and to provide better customer service. So those are the three focus areas I'd like to outline moving into the future.
The community meeting is on the 25th. That's a Thursday.
Thank you. I'm one day shy. It must be because of leap year.
Leap
this year.
February, yeah.
So it's Thursday, February 25th.
Correct.
It's at 6 p.m. and it is at
Montevilla Baptist Church in Southeast Portland.
Montevilla Baptist Church, and we'll make sure that you get that information. Very important town hall for our veterans in our community.
Hi, Joanne. Second question. I'm still Rob Solomon.
Yes, Rob.
I'm going to start off with an assumption, and you might tell me I'm wrong, but I'm assuming that there's an awful lot of patients at the VA that you provide substance abuse assistance for, addictions, chemical dependency. And you gave us a wonderful list of what you do, and there's a lot of mention of mental health, which is obviously important. If you're subsuming addictions work under mental health, you would be the first government agency, in my experience, state, federal, to do so. Is that what you're doing, or is it listed separate?
So at VA Portland Healthcare System, substance abuse is one of the full range of services provided by our mental health division. We really see that the very complex needs of those veterans and alignment-wise, we have a group of interdisciplinary clinicians that come together to take a look at that specific population. So obviously, it's not only mental health that contributes to that, but we have aligned it there, and then they collaborate on each individual veteran with the other leaders of the other clinical departments to make sure that the individual needs of every single veteran are addressed. Thank you.
I'm Phil Nelson, forum member and veteran, and also on Medicare. And what I'm curious about, do you have income or Medicare eligibility questions that you ask when someone appears for services? If you're on Medicare, do you still qualify for VA? And again, is there an income cap or resource cap if you have more than that you're not eligible? Thank you.
Thank you, and thank you for your service. Yes, our eligibility requirements are very complex. They're based on service connection. They are based on income threshold and other factors. And I tell any veteran, Medicare or not, that if they have questions about their eligibility, we have a whole team of business office staff who take calls all day long to be able to determine if an individual veteran is eligible for care. So the answer to your question is that it depends on each individual veteran, but yes, income is a part of it, but also a service connection. So depending on your service connection, income does not become a factor, depending upon your service connection. And then the latest legislation, which passed a couple of years ago, and actually was extended for our newest veterans, those who've served in Iraq, Afghanistan, and other active theater, when they leave the military, irregardless of service connection, irregardless of income, they are eligible for VA for 5 years. So I always say anyone who has questions about eligibility, call us so we can get an expert to help determine whether you're eligible for health care. Thank you. Sir.
That question is very poignant to me because I was declined service because I had too much income. What's the limit?
The question is, what is the limit? And I don't know that off the top of my head. So I'll make sure that I want to give you the most recent up-to-date cap limit. It does change, so the business eligibility, so I'll make sure that we follow up and get you that amount.
Thank you.
Yes, sir.
The real question I had was, in reading about you, I saw that you wanted to hire 21 new doctors and stop the overtime and stuff that was going on before. How's that worked out? What are your staffing needs today?
So the question was, one of my priorities was to hire 21 physicians. That initiative had to do with primary care, and it was not linked to overtime. It was linked to access. In 2013 calendar year, we had a significant number of our primary care providers move on to other opportunities. This could have been because they were eligible to retire. Some of them had a family member, like a spouse, who was moving and they wanted to stay married and move with them. And some of them had found another better opportunity. So we had a significant number of vacancies when I arrived on May 31st, 2014 in primary care. And we have leveraged everything that we can think of to recruit and retain primary care providers. We continue today to have that as a huge strategic priority. Not only are we finding that there is a lot of demand for primary care providers in the community, and in fact, if you read some of the predictions on the national shortage of primary care providers by the year 2020, all I can say is stay healthy. I mean it very sincerely. And everyone says, well, recruit them. There aren't enough out there to recruit. And so we continue to offer competitive packages. We have education debt reduction programs. We provide support for education. Today, we continue to be challenged to be able to hire enough primary care providers to take care of the need of the VA Portland healthcare system. And we will continue. Every single day I get a report. Now, it's fluid because every day some people come and every day what? Some people leave. It is today continues to be a significant challenge. And if you look across our healthcare system, every week I get where do we have vacancies that we haven't filled and where we're at with status to not only recruit them. And there are other specialties that there just aren't making enough of those types of providers to meet the needs, not irregardless of the VA, but also across the country. So as we are looking, for example, for orthopedic surgeons, and as other private sector facilities are looking and have shortages in those same areas. So we continue to do everything that we can do to attract the brightest providers and support staff, because it takes a team. It takes everyone from the provider to the nurses to the clerk. And we continue to do everything we can. But primary care today, and in some of our specialties, continues to be a huge strategic priority, and we have shortages in those areas.
If you had a wish list, what would you wish for?
Oh, I wish wish for so many things. If I had a wish list, I think that Secretary McDonald has heard about how we need more flexibility to be able to leverage everything that we can do to bring on the most talented staff in the country. I think that we are a government agency and we're held to government regulations, and sometimes we are challenged. We all have to be fingerprinted. There's all the security checks. Those are all needed, not needed in the private sector, so they're able to be more timely. So I think addressing some of those very old laws and making sure that we have some flexibility to get people on. I guess if I had another wish, I would continue to wish for veterans to be true partners in their health and their care, that we work together to make sure that not only do we provide the best care, but we really start to focus on healthy behaviors and prevention. You know, we've been very good at, oh, we're sick and now we take care of it. And I think if I had one wish, it would be that we had better partnerships to help everyone to live healthier lifestyles so we prevent some of the things that we're seeing in our veterans today. So that would probably be one of my wishes on the top of my list. Thank you.
Joanne, thank you very much. I know you have to leave right away. Thank you. You know, excuse me, just while you're packing up, I want you to hear this. We do as much promotion for the speakers as we possibly can. And for those of you, by the way, that are on Facebook that haven't friended us yet, please do. You'll learn some things. One of the things I learned is that there is somebody out there, when they saw that Joanne was speaking today, they wrote, Joanne is a wonderful lady, very dedicated to the health and care of veterans. I doubt very much that that's hyperbole. Having listened to you today, I'm sure that's a very well-deserved compliment. I wanted to ensure that you knew that it came. Thank you very much again for your speech.
On behalf of all of our staff, it was a true honor and privilege to be with you this afternoon. I appreciate the kudos. It really is a reflection of the absolutely fantastic care and service that all of our staff provide every day. So thanks so much. Thank you for your support of our veterans. Thank you to our veterans in the audience.
Ladies and gentlemen, next week, I hope you'll be as polite to this gentleman as we certainly all were today. We have Mark Catches, who I'm sure is a nice man, but for those of you that don't know, he is an editor of the Oregonian. That's the newspaper that we still have in Oregon. Following Mark next week, we have Annette Evans from the Washington County Department of Housing and Human Services. She will be talking in terms of the housing crisis, homeless issues. And on the 22nd, that was the 22nd. On the 29th, we have Jake Weger from the Oregon Alliance for Gun Safety, who will be talking about, we obviously know what he'll be talking about. He'll have many bullet points that day. Ladies and gentlemen, thank you very, very much. We'll see you next week. Take care.
Was it worth your while? Was it worth your while?
Oh, yeah.
Excellent. Excellent. Will I see you at Wynn's house?
Yeah, I refuse to do it, so.
Doesn't know me.
Oh, okay. Brett for the Brownovakian party?
Yeah, she has them all the time.
Oh.
I can't believe it.
Yes, she does.